Welcome back. The deadliest form of skin cancer just received approval for a new therapy treatment. The FDA gave the okay for the treatment for melanoma. Here to tell us more about the significance is Dr. John Dubois, a board-certified fellowship-trained medical oncologist and hematologist at Jupiter Medical Center. Thank you so much for being here, doctor.
Thank you, Stephen.
First of all, tell us why this treatment is so exciting.
Sure. This is really an important advance in managing this type of skin cancer, melanoma, which is the most lethal type of skin cancer that we have. It's critical because this type of skin cancer, when it spreads throughout the body, is typically not very responsive to chemotherapy, even though it can respond to immunotherapy. So this new technology, tumor-infiltrating lymphocytes, is the first cell therapy FDA approved in any solid tumor for the treatment of melanoma. And as a backdrop, basically we all have lymphocytes that do circulate around in the blood. They protect us from viruses as well as cancers in some situations. We know some of these lymphocytes can get into a tumor and try to attack the tumor cells. The problem up to now is that the tumor cells outnumber the lymphocytes, and typically the responses are not that great. So the tumor-infiltrating lymphocyte technology allows us to take a lump of tumor out, and in the lab we can harness and extract these lymphocytes. But instead of just having thousands, we can grow them up to not just millions, but billions. And then we can give them back to the patient. They will get back into tumors, but this time they will outnumber the tumor cells and be successful in eradicating the tumor, or at least creating responses in as many as 35, 40, 45% of people.
Sounds like a lot of science behind this, and this is again for advanced cases
where
a tumor has formed. So we live in the Sunshine State. We know skin cancer is definitely a concern. So tell our viewers what they should look out for so we don't get to that point.
Sure, it's a critical question, and hopefully I'll have an adequate answer for you. Skin cancers are the most common skin, cancers that we diagnose. The good news is that typically the more common skin cancers are very manageable with excision or freezing, and those are called squamous cell cancers or basal cell cancers.
Right,
so luckily the lethal, more dangerous melanomas are less common. What can we do? We typically will advise a little less sun exposure during the peak hours between, say, 10 and 2. And everybody knows it's critical that we apply suntan lotion, at least 30 SPF on up, and to reapply if you're spending extended time in the sun. And as we all know, there are now new lines of UV protective clothing that can also reduce the risk of skin cancers.
And speaking of these preventative measures, we know spring break's around the corner for a lot of families. Of course, parents going to be looking out for their children.
Yep.
You don't hear of too many cases, at least I don't, of kids getting skin cancer, but it's possible that it can happen.
It can, and there are some rare hereditary or genetic forms of skin cancers, including syndromes that do lead to an increased risk of melanoma. But I think the most critical issue for kids is to at least have them not be overexposed and have sunburns through their early years. The problem with skin cancer is sometimes it's years between the exposures and the sunburns and the development of the actual cancer.
Okay, we're running out of time, but really quickly, I want to go back to that treatment. If someone were to ask a doctor about it, is it a specific name that's for it? Or?
Yeah, so it's very important that we remember tumor-infiltrating lymphocyte. Rather than the commercial names, I think TIL cells or cell therapy is really what you want to remember.
Thank you so much, doctor, for stopping by. We really appreciate it. A very, very important topic here in South Florida. If you want more information on that treatment, make sure you head to our website, WPBF.com. We have an article up right now.